Assalamualaikum. In this video, I am discussing a recall communications that is with medical students. Talk about the sensory processing disorders. Actually, it comes with mixed autism spectrum disorder and sensory processing disorder. Here we just discuss sensory processing disorder. So first of all, what is sensory IRCAP? We maintain introduction, repo, taking the consent, agenda telling, and also any attendance. Okay. So what is the definition of sensory processing disorder? It is a disorder that affects how our brain processes our sensory stimuli. For example, what we see, what we hear and what we smell, what we touch, where are we exactly. These are just examples. Some children are oversensitive or undersensitive to the stimuli around. So sensory processing disorder, it's how our body actually react with the sensory stimuli, what we see, what we touch, what we eat. Some are overactive, some are underactive. So what are the types? The types are three types. One is sensory modulation disorder, one is sensory based motor disorder, one is sensory discrimination disorder. So sensory modulation disorder, it is like under or over response to the sensory stimuli. Sensory based motor disorder, what is? There is coordination and balance are affected. Sensory discrimination, difficult in understanding the characters or environment. So sensory modulation, sensory modulation disorder, sensory motor disorder, sensory based motor disorder, and sensory discrimination disorder. These are sensory modulation, discrimination, and motor. Modulation, motor, and discrimination. Okay. So how can I suspect? The examples I am giving. He covers his hairs when loud sound that normally not annoys the other people. May have issues with food texture and gagging with certain textures and cannot be touched enough. So the child may be like a noise occur. We all are sitting, we all are normal. But the child is reacting too much. He's covering his ears because he feels like that's too much sound. Also touching, like if you touched, cannot be touched. He avoid. May have issue with food texture, like you have given food. His problems. Is sensory processing disorder related to autism all the time? No. Some children have only sensory processing disorder and also can be features of autism. So it is not that all the time autism is associated with sensory processing disorder. You cannot tolerate loud noise. Is this mean I have sensory processing disorder? Actually, sensory processing disorder is a condition in childhood. But if this loud noise cannot be tolerated by others, so you do not have sensory processing disorder. But if you are annoyed with this sound, others know. So you may be sensitive to this loud sound but not sensory processing disorder. So sensory processing disorder, in shortly SPD, it is a childhood conditions. In this adult life, if there is any noise, then there may be sensitivity to the noise. What is the cause of sensory processing disorder? No one knows yet. What is the treatment? It is a multidisciplinary team. Occupational therapist is the main one in the treatment. So remember, sensory processing disorder, occupational therapist is the main treatment. And it is three types. So you know, sensory modulation, sensory motor, and sensory discriminations. Look the pictures. Sensory modulation is that avoiding, seeking low registrations. Sensory discrimination is like visual, auditory, tactile, taste and smell, position or movement interceptions. Sensory motor are difficulty with movements and sequencing, poor postural control. This is all about sensory processing disorder communication. Thank you.